foam rolling the upper legs, the thighs, as well as the pelvis. You can start with your hamstrings, which begin in your popliteal fossa, the soft area behind your knee joint, and take the roller all the way up to your sitting bone, your ischial tuberosity. There are three major bellies of your hamstrings, your semitendinosus, semimembranosus, and biceps femoris. By internally and externally rotating your hip as you're rolling through your hamstrings, you can hit all of these bellies. And once you finish, you can scoot your body forward a little bit and run the roller just over your sitting bones. So these are your ischial tuberosities. And these are the points at which your hamstring muscles insert into your pelvis. These areas experience a lot of burden when your legs are very active. And by rolling over your sitting bones, you decrease risk of injury to these tendons and also to your actual muscle bellies of your hamstrings. You can just see from a back perspective what this looks like. It's just a very short amplitude. So starting just in front of your sitting bones, rolling over your sitting bones, and then going just behind your sitting bones, back and forth. Next, your hip rotators and extensors. You want to go ahead and rotate your hip and bend your knee to 90 degrees and rest one ankle on top of the opposite thigh, and then use your upper arms and the leg on the ground to gently rock your body back and forth and rotate it a bit side to side so that you can roll over all aspects of the back of the hip region on one side. This is just a back perspective, and you're aiming to foam roll over your external rotators, your internal rotators, as well as your gluteus maximus, which is your main hip extensor. As always, be sure to get both sides. And about 5 passes is sufficient for general maintenance and general recovery, but if you've gone through a lot of vigorous activity, you can do as many as you'd like to help facilitate clearance of lactic acid from your muscle tissues. Next, your quadriceps. There are 4 bellies here: your rectus femoris, your vastus lateralis, medialis, and intermedius. They form your quadriceps, and they go all the way to your quadriceps tendon, which is just above your kneecap. So you're rolling from the tops of your kneecaps all the way up to the fronts of your hips. And as you're rolling your quadriceps, you can internally and externally rotate your hips, which will allow you to get all of these muscle bellies. Next, you can get your hip adductors. So these are your inner groin muscles from your knee joint all the way up to your hip joint. You have your adductor group, the magnus, longus, and brevis. You have your gracilis muscle, as well as parts of a smaller muscle called your pectineus. This area tends to be very sensitive in most people when they first get started, so be very conservative and only use as much pressure as you can tolerate. You may find that there are some areas that feel especially tender as you run the roller underneath them, and if you get to that type of area, what you can do is you can stop, and with a bit of pressure on that area, you can keep your knee flexed to 90 degrees and lift your foot up toward the ceiling a bit, whatever degree you can. This is internally rotating your hip and just accentuating the massaging effect on the hip adductor group. Next, you can continue on the fronts of your thighs, so you're getting your hip flexors. And this is another area that tends to be very tender and tight in most people. So as you're running passes through your hip flexor area, If you find that there's a very tender area, you can stop, keep your knee flexed to 90 degrees, and then let your foot fall out toward the ground laterally. This is again internally rotating your hip and accentuating the massaging effect on the muscle under the roller, which is in this case the hip flexor. So be sure to get both sides. Again, it's your hip flexor region. This is just above your quadriceps, but not into your abdomen. And again, if you find that there are some tender spots, you can stop on those spots and you can internally rotate your hip to really work through that muscle on the roller. And then you want to work the outer aspect of your thighs, which is your iliotibial band. This tends to be extremely tight in people who are very active, especially with repetitive activities. So long distance runners tend to have very tight iliotibial bands. So be conservative with this. If it's too tender at first, you can regulate how much pressure you apply by distributing your body weight evenly through your upper body where it's contacting the ground,